this red dot right here represents the food. Food comes in here and it gets broken down by the acids. As the food enters the small intestine, bless you,
Thank you.
there's certain enzymes that are activated that allow for your intestines. Let me see real quick. Imagine that like your intestines is like, these are your intestines, and you have the food, which is of course has sugar in it. All carbohydrates have sugar in it, right? They get all converted into sugar. And so there's certain enzymes that help push that sugar into the bloodstream that you have surrounding the intestines. And let me see, all the capillaries that will eventually take that's what takes the sugar from the carbohydrates into the bloodstream. Does that make sense?
Yeah.
Okay. That's one way that's how your body gets its sugar into the bloodstream. Then of course you have the pancreas, which I didn't draw right here, but I'm gonna draw it in blue right here real quick. It's somewhere, it's like right here, right? And it's connected to the duodenum. And so the pancreas is the one that releases your insulin. Your islets of Langerhans have your alpha and your beta cells, and I believe it's your beta cells that produce the insulin one, right? Again, those beta cells produce the insulin. Now in type 2 diabetes, it's producing it, just maybe not enough. Does that make sense?
Yeah.
So just know that you have cells that produce and they release insulin. That's another way that we can control blood sugar naturally. This is not type 1, type 2 diabetes. I'm talking about how your body normally controls blood sugar. And then there's another way. Your liver is like the refrigerator of your body, and your liver stores sugar. And so what it does, it stores sugar in a form of something called glycogen. And then your pancreas releases glucagon, and that tells your glycogen to turn into glucose, and now your cells can absorb the glucose because that's the actual sugar. Glycogen is a stored form of sugar. And imagine putting food leftovers in Tupperware and in the fridge. If you want to eat it again, you can't just take it out and eat it. You have to take it out of the Tupperware, put it in the microwave to warm it up and prepare it, right? Well, that's the analogy from glycogen to glucose. Glucose is now prepared, and you can now consume it. And you do that by the release of glucagon. That increases blood sugar levels by this mechanism right here of converting glycogen into glucose. Is that clear?
Yeah.
On top of that, your body also has, we discussed the cells. The cells develop an immunity almost to the insulin because you have such a shitty diet. So your cells have to take the sugar. Can we just agree on that basic premise, right?
Yeah.
The type 2 medications, the type 2 diabetes medications are going to affect one of these mechanisms. They're going to enhance it, whether it's, remember, in diabetes, we're trying to reduce the blood sugar issues, right? Because all you have to do to bring it up is eat. But the issue is lowering the blood sugar. So we have ways of blocking this glycolysis, the neoglycolysis, which is the conversion of glycogen to glucose. Some of the type 2 diabetic medications, they block that mechanism at the liver, such as your metformin. Okay. There's other drugs that increase the production or the secretion of insulin. It maximizes its secretion. That's another way we can control blood sugar in people that have type 2 diabetes. Another way is, remember how we talked about that the food right here is being absorbed, the glucose is being absorbed into the blood vessels because of an enzyme. Well, we have other drugs that block that enzyme so we don't increase blood sugar. So it reduces the way that we absorb carbohydrates, sugar into the bloodstream. That's another way. And then we have other drugs that's like a counselor that tells the cell, hey, let the sugar in, let the insulin work on you. It's like going to couples therapy and the therapist telling you to forgive your boyfriend. Does that kind of make sense?
Yeah.
So you have these various mechanisms of that your body naturally undergoes to maintain blood sugar levels. Type 2 diabetes medications is working on one of those mechanisms. It's either enhancing or blocking one of those mechanisms. Does that make sense?
Yes, for now.
For now, okay. So just know that it either works on the liver, it works on the pancreas, it either makes you have more insulin, or it's something to do with your GI tract. And because of that fact, that's why it's diarrhea. The most common adverse effect of a carbose, an alpha glucosidase inhibitor, that's that enzyme that I was talking about that's needed to absorb the glucose from the intestines. Well, this inhibits it. So that's how your intestines are not releasing sugar into the bloodstream. Does that kind of make sense?
Yeah.
And that's why they include abdominal symptoms such as diarrhea, abdominal distension, and cramping and flatulence, because it's altering a normal pathway of metabolism, except it's focusing on the desired effect of not increasing the absorption of sugar. Does that kind of make sense?
Yeah.
And so insomnia has nothing to do with any of these things, right? Polycythemia has nothing to do with these things. It says acarbose is more likely to cause anemia, but again, it has to do with the absorption. And this is more things that you can start reading into. The odds are they're going to ask you basic questions like this within the scope of the LVN. Does that make sense?
Yeah.
And then it says acarbose is more likely to cause headaches, but again, not joint pain. So out of all of these, the only one that by looking at it, based on what I discussed, it's going to be diarrhea, because that's the only one that perhaps alters one of the various mechanisms that type 2 diabetes medications work. Is that clear?
Yeah.
All right, cool.